For the first time ever, Lumineers provide a non-invasive way to perfect smiles painlessly, with no shots and no removal of sensitive tooth structure. This DVD will present the Lumineers step-by-step technique, a revolutionary advancement in cosmetic and restorative dentistry. Karen Hendricks, an actress, desired a Hollywood smile, but was apprehensive about the pain and permanent loss of tooth structure associated with traditional veneers. The majority of cosmetic dentists would never have considered her a candidate for this type of invasive procedure. Then she discovered Lumineers. The unique properties of ceramate porcelain produce an ultra-thin, ultra-strong veneer that easily slips over existing teeth, eliminating the need for tooth preparation that is normally associated with traditional veneers. Lumineers is the only veneer made from ceramate porcelain, which is manufactured exclusively in the Ceramate Smile Design Studios in Santa Maria, California. Only Lumineers are clinically proven to last over 20 years and provide a 5-year limited warranty when placed with UltraBond and the 10-year multipurpose bonding system. Always have patients complete the smile evaluation form to begin the dialogue for a Lumineers smile improvement plan. Determine if any pre-treatment cosmetic contouring is necessary, and then take an accurate impression. We recommend pouring your own models to ensure exceptionally sharp margins. Take before photos of the patient, including full face and upper arch. Complete the studio prescription form, which clarifies specific preferences of shade, surface texture, and other patient preferences, and send all photos to the Ceramate Smile Design Studios. In this case, the patient requested that 8 Lumineers be placed on her upper arch. Her smile was transformed from good to gorgeous in less than an hour and was completed with no shots, no drilling, and without the removal of sensitive tooth structure. The procedure is simple and easy. Lumineers are prepared with ceramate porcelain conditioner and ceramate prime. The patient's teeth are thoroughly cleaned, then etched using Denmat's medium viscosity etchant. It is essential to utilize 4-power magnification throughout the Lumineers procedure. 4-power magnification enables greater accuracy and decreased eye strain. All 8 of the teeth are etched simultaneously. The etchant is rinsed and the tooth surfaces are dried. Paint each tooth with several coats of tenure A and B, a self-cured adhesive bonding agent. Allow the tenure to sit for 10 to 15 seconds and then air dry gently. A shiny appearance on the tooth surface should be seen. To protect against possible contamination, apply a layer of tenure S to the teeth. Remember to not light cure until the Lumineers have been seated on the teeth. Seating is done with the use of UltraBond resin cement. The Lumineers are heavily coated with UltraBond and gently seated on each tooth. Seat the Lumineers one at a time with enough force to extrude all excess UltraBond. There is no need for interproximal matrix strips. Curing is done with the sapphire light. The Lumineers are cured 2 separate times during the seating process. First, cure the Lumineers with the Cerataper 2mm tacking tip for 1 second on each tooth. With the Lumineers tacked in place, remove any excess UltraBond using a brush dipped in tenure S. Make sure that all of the excess UltraBond has been removed before fully curing the Lumineers, which reduces finishing time by 50%. To fully cure the Lumineers, use the 9mm curing tip and light cure the Lumineers for 5 seconds each. The Shure 349 instrument easily removes the cured UltraBond on the Lumineers surface without damaging the porcelain. The UltraBond adjacent to the Lumineers is removed using a football-shaped diamond burr. This diamond burr selectively removes only the UltraBond without damaging the aesthetic glaze of the ceramate porcelain. All overhangs must be removed during the finishing process. A fine diamond burr is used for the final finishing of the porcelain margins. Smooth, seamless margins are essential for long-term periodontal health. This accurate technique requires the use of 4-power magnification and will reduce the shoulder at the gingival margin and mimic natural slope. Because the porcelain lumineers are bonded without the use of matrix strips, it is important to reopen the interproximal contacts with a finishing burr and the Serra saw and interproximal dental saw. Before dismissing the patient, remember to adjust the occlusion and centric throughout all excursive contacts. The Lumineers placement technique provides substantial advantages in cosmetic and restorative dentistry. The procedure is simple and time-efficient, and sensitive tooth structure remains intact. With Lumineers by Serenade, patients love their permanent, pleasant, and painless smile.
It's really exciting to be able to change the way that you look so drastically. It just completely has transformed my mouth. I don't think I would have done it if I had to have shots and drilling. And I have a performance tonight, and I'm not worried about getting up on stage in front of 400 people and performing. I feel natural. In fact, I'm excited to do it. I'm excited to open my mouth and sing and show my teeth.
The Lumineers procedure requires the use of the following materials to create a long-lasting smile restoration: Serenate Porcelain Conditioner, Serenate Prime, a ceramic primer and conditioner set to create a high-strength chemical bond between porcelain and composite that is micro-leakage free. Ultrabond, a highly aesthetic, stress-resistant, infinite cure composite resin. Tenure MPB, a multi-purpose, ultra-strong adhesive bonding system. When used with Ultrabond, Lumineers are backed by a 5-year limited warranty to guarantee success. Tenure S, an unfilled resin with HEMA that seals and protects against possible contamination and allows for easy cleanup of excess Ultrabond. Sapphire Plasma Arc Curing Light, intense power to cure through porcelain, quick 3-second restorative curing, and 1-hour hands-free bleaching. Lumineers Magnification System, 4-power magnification loops for exceptional accuracy and decreased eye strain. Lumineers Finishing Kit, everything needed for the final finishing of the Lumineers. Shure 349 scaling instrument, the Serra saw and Serra sander, which reopen interproximal contacts, and an assortment of fine diamonds and burrs to create feather margins and eliminate shoulders. For your convenience, the Lumineers placement system includes everything you need from placement to finishing. This kit eliminates multiple containers and makes setup a breeze.